Hi, Dawn Thomas from Dawn Thomas Physical Therapy. I'm talking to you today about why I don't very often prescribe neck stretching, at least right away. Most people, when they're trying to stretch their neck, they tend to pull too hard. They tend to give more force on their neck than they need to get the stretch that they need. They don't usually understand where they're supposed to be feeling it and what they're supposed to be feeling. And so what happens often is they get more pressure put on joints that don't need pressure on them and not enough pressure on the muscles that they're trying to stretch. So I'm going to go over how to actually do the most common stretch that we do in the neck is the upper trap stretch. So that's that thick muscle that people usually are complaining of pain and stiffness, that thicker muscle between the shoulder and the neck. And that's where most people tend to feel stiff. So in order to stretch that muscle effectively, I need to start by just gently giving a nice long neck posture. I'm going to stretch my left side. I'm going to take my left hand and I'm going to gently hold the seat of my chair. And by gently holding the seat of my chair, I'm going to anchor my left shoulder so that stays stationary. Then I'm going to start to think about positioning my neck and my head. I'm going to slightly look down. I'm going to tip my right ear towards my right shoulder. Then I'm going to start to turn my chin slightly up. Now, once I get into this position, I need to think about where I'm feeling anything at all. Where am I feeling it? I'm feeling it on my left side in that target area. So that's good. If I'm feeling it on my right side, then that's not good, because what could be happening is as I'm bending to the right and stretching to the right, if I'm feeling something on the right side, that usually means I'm compressing something on the right side or giving compression on the joints on the right side that tend to be sensitive, and I should not stretch in that direction if I'm getting that sensitivity or pinching sensation or discomfort on the right. So if I'm stretching to my right, I should feel stretching sensation on the left. So that's location. So if I'm down, tip, turn, and I say, am I feeling it on the left? Yes. Am I feeling a stretching sensation? Yes. As opposed to a pinching sensation. Then the last little part of the movement is I can lean a little bit to the right, and that can exaggerate the stretch just a little bit. And it should stay in that same spot running along the course of that upper trap muscle and nowhere else. I should only feel that sensation along the course of that muscle here. I'm gonna hold that for a 15 count. And then I'm gonna relax and I'm gonna come back to my neutral position. I'm gonna move gently, make sure I feel good on both sides, and then I can try the other side. Most people tend to grip too hard with the hand and then they end up pulling up. And what happens when I do this is I'm activating that upper trap muscle, and what I'm trying to do with the stretch is to relax that trap muscle. So if I'm grabbing and pulling, then that's counterproductive. I'm not getting the relaxation effect that I want. The other thing people do a lot is they'll want to bring up this other hand and pull, which this is not an incorrect addition to the stretch. However, I don't think it's very often needed. If I'm in the correct position and I'm doing all the positions correct and I'm gently holding on the chair, I almost always don't need that extra pressure with the other hand. So the risk of using the other hand to give that extra pressure is causing more compression through the spine from the top. So again, people tend to work too hard and pull too hard, And if I pull too hard, I might get the pain on the right, and I also might give too aggressive of a stretch on the correct muscle, which can end up creating more of a rebound effect and not a relaxation effect. We're trying to relax the muscle, not stimulate the muscle. We're trying to, well, stimulate it in a way to relax it. So those are some tips on how to accurately, effectively, and safely stretch the upper trap.